And welcome back to the Nutrimedical Report Live for hour number 1 on Friday, the 5th of June. And Michelle, you have some announcements to make. Go right ahead. You're all set.
Hey, Bill. How are you?
Good. Lots of stuff to do today. I've been multitasking. And, of course, you have a big announcement to make. Go ahead.
I want to apologize for people that didn't find the show last Friday. A few people didn't find it because it was broadcast on Thursday, but it wasn't rebroadcast this time. So if you're looking for last Friday's show, the firing line, it was on Thursday, the day before.
Right. I did announce it, but I only announced it once on the Friday show, first hour.
Yeah.
When I had our guest on for hour number 1, because you have been traveling. Okay.
Yeah, so if you need to listen to it and you want to hear all the interesting emails from all of our wonderful listeners out there, just check on Thursday first hour, because I haven't missed a Friday show in years, actually, and we'll do it on a Thursday or a different day, so if you don't hear it,
you check the schedule, look at the front page too, Nutrimedical, or just check. If you're listening every day, you're going to hear the announcements. But I'll also make sure I announce more times.
Yeah, you have to repeat things.
You repeat it for people,
Repeating is good.
Yep.
You should be used to repeating for me. You have to repeat something over and over and over, so you should keep that in mind.
It's part of my skill set. Go ahead. You have another big announcement.
Oh, you just can't wait, can you?
No.
Look at you. Okay, I'm going to go right for it. Bill can't wait until I make this big announcement. Let's see if I get this right. Okay. Bill, pay attention to me if you want me to say the announcement.
I am. Go ahead.
Are you there? Are you with me?
I am.
Okay, I'll try this all by myself. You realize that I know that you're listening, and I can just imagine you all out there, because actually we're getting to meet a lot of our listeners. We had our friends from Chicago, Pam and Len here a couple weeks ago, and a couple weeks before that we had our friends from Edmonton, Alberta, and just this morning I got another email. So you know what, Bill and I love to socialize, don't we, Bill? So when you're regular elite Nutrimedical customers, hey, we're here for you. If you're not a Nutrimedical customer, I apologize. We are definitely not there for you, but once you become a member of our big family, you have access to Dr. Bill.
Yeah, you were going to say something else too.
I am going to say something else too. Maybe you should say it, Bill.
Basically, I've been expanding the number of other programs I do, even interviews, and yesterday I actually did 7 hours of radio. On a regular basis, I do 4 or 5 hours a day, but I also do consults and teaching and research. So what we've done now is we have a lot of people that sometimes will ask for advice, and we check to see, and they never purchase a product. And they get free advice, which is not good, because they're not going to get inferior products, just like I heard the last commercial about, heart and body, which is inferior to our cardiovasc. And people should know that I don't endorse any other products.
Cardivite.
Yeah. Cardivite or cardiovasc is a new term. Right?
Yes,
by the way, I have the cardiovasc bottles and a dropper up on their cardiovasc. It's on our site.
Okay, finish up what you're saying.
So the announcement is that I posted up last week that I have a consult form I've completed that's a multi-page PDF form. Mm-hmm. And if you send me like a multi-page thing asking me to analyze it, quote free, etc., that's stopped.
Yeah.
You have to fill out my form and pay the fee. It's $150 per half hour for reviewing the form, for whether it's talking on the phone or doing email or preparing reports. It's $150 per half hour. For phone consultations, except for our elite people. By the way, people who are our elite customers, they don't pay for phone or emails.
You kind of said it in the backwards way, because I just wanted to clarify in the way that I wanted to announce this, is that our customers, our elite customers, you know who you are. You support Nutrimedicals.
Right.
Because of you that we sit in these chairs here today. Because if you weren't there, and seriously, you're about a few hundred, even though we have hundreds of thousands of listeners, apparently, GCN says.
Probably a lot more than that.
But you are like in the hundreds
the core,
of who you are, the core, and you know who you are, and you know you support it.
Yeah,
Dr.
so you don't need... Yeah.
You've done that for so long, and we're talking years, that it's the only reason we're sitting here. And what's happening is other people are just moving in, asking questions, keeping Bill on the phone, doing this, and his by the kindness of your heart, you're trying. And
I can't do it anymore
because of your compassion. You do it over and over and over.
Yeah.
But now that you're so busy, and now that you've got a couple, you're on the air way more now. Besides, which I won't say
it's
too
not
much
possible.
about.
Yeah.
It's impossible.
Right. So no, let me finish then. Okay. So
I just wanted them to know that they are always free. All consults, phone consults.
My turn.
Can I just say for the elite Nutrimedical customers are always free. Anytime for the phone, anytime for the email. They know who they are. I know who they are.
Right. In fact, we have a list here that we exchange between our routine people. Anyway, so number one, if you're not an elite customer, you're going to be paying for a phone consultation at $150 per half hour, and for emails even, you're going to be paying $75 per unit. Now, if it looks like you send me a massive email with a ton of stuff, I'm going to say, I'm sorry, I'm going to email you back to say, you need to purchase this before I respond to this with by verifying that you've actually paid the email consult fee request. And I also embed the form in both of them. So if it's real complicated, I may just send it back and say, no, what you've asked me, I do not have adequate information to answer correctly, because it may ask a very complex medical question, or integrating with natural medicine, or a research question, or how to support them metabolically. Like we had a request earlier about a genetic disorder, and that person was not a customer. They're going to have to pay for a proper consult for me to do the research on PubMed, find the nutraceuticals, and do all the other work, and find clinics that can treat them. And I can do that for them, but my time is limited. I can't do this anymore.
And if they're serious, they will. They will.
And I'll provide them a very good quality consult. But except for early customers, all emails, there'll be a fee, and also phone consultations. There's none of this freebie stuff anymore, because I'm just so overwhelmed with how many people around the world are asking for me to provide free advice. In many cases, for some reason or other, they think they can get the free advice and then they don't take it. They actually go off and try to get, they think comparable nutraceuticals elsewhere, or try other advice. And I don't want to waste my time. If they're not really if they really want help, I'm going to provide it, but they need to follow the plan that I provide.
The day is come. It's here.
Yep.
That's it. And that reminds me of a Bible verse from 1 Thessalonians 5:11. Wherefore comfort yourselves together and edify one another, even as also ye do. We edify you, you edify us. Correct?
Very good.
Is that good?
Yeah, that's very good.
Okay, this morning I got to talk to Maria from Virginia, Bill, about her mom, Helen. Now there is Maria, one of our elite, I know it sounds pompous almost, maybe I should change the word, elite Nutrimedical customer, but that's what she is. And Bill, her mom, I don't know if you remember, you've helped her and many members in her family, but her mom recently had UTI, urinary tract infection, arthritis, and heart problems. And Maria called me this morning, wanted me to tell you, Bill.
Yeah.
If you look at me, I'll tell you. Hello, over here, Bill.
Multitasking here, wait a minute.
Okay, can you hear me?
I can.
At least?
I can, yes.
Thank you for looking at me. She wanted me to tell you, Bill, that you saved her mom's life. That her test came back negative. She's not osteoporotic anymore because she took the full protocol.
Right. She actually listened to the advice and did it. Yeah.
Everything's negative, UTI, everything, and she just wants you to know that she just loves you. Maria loves you.
I'm going to give all the credit to God, because whatever talents I have, God's given them. Whatever opportunities to network with other specialists, doctors around the world, scientists, I give God the credit. But here's a list of conditions that I know we've just, even recently, but over the years, we've done many others. Hepatitis B and C we've turned off, AIDS we've turned off, reverse cataract, stopped traumatic brain injury, fought and defeated cancer, turned off osteoporosis, unblocked arteries, stopped congestive heart failure when they tell it's not possible. So many conditions: NICA, periodontal bone infections, inflammatory colitis, stop people from dying of peritonitis, etc., tuberculosis, and also Jack and January, Ebola. Not one person that got her Nutridyne got Ebola, including Ragnar Ministries.
It's amazing how you can just rattle that out so quickly. I'm amazed.
Are you still looking for that one iodine that you can really trust? A medical
machine gun.
That's what I am, Mr. Machine Gun here. Oh, here's my hill.
It turned out that I needed you to do it, though.
Dr. Bill Deagle's
I needed you to do it.
proven time and time again to be the very best iodine available for you. Nutriodine is the only Tesla-activated monatomic plasma iodine in the world. It optimizes mitochondrial function.
You don't need to do that right now.
I'm trying to get it all up so it's there.
The venom from a desert recluse spider bite in Southern California to eliminating malaria reported by medical missionaries in central India. Dr. Bill's
Boy, if I ever got the answer for the affiliates, Phil, you wouldn't believe what it is. We used to do it before.
Yeah? I'm sure you.
Yeah, I get clicked in. I go, oh my God, we used to do this before, and I go, it's in that one field. You'll remember it.
Welcome
back, and Michelle, we have lots of questions to answer. We're ready to roll.
You look like you're a happy bee.
Yeah, I'm pretty happy. Yeah, I'm trying to get everything organized. We're actually doing a lot of new advances. We've got our scientists coming from China and working with some scientists from Russia. We have lots of new nutraceuticals we've just launched in the last few months, like Sports Energy Lights, Mega Muscles, Calm Mind, Brain Mag. I mean, we're really developing new protocols. The book, Dr. U's coming along nicely. Everything's coming along good.
I talked with Steve from Missouri. Hey, Steve. This morning, I talked to him, I guess, about a month ago or so, and I asked him to, he was saying, what were some of my favorite products? So I said, of course, the life support, right? The Ageless and Life Support. But if I had to get one product, it'd be the Life Support chocolate, as you know, right?
Right.
So anyways, he tried it for the first time here yesterday. He got it and he tried it. And you know what? I told him, I said, as soon as you take a drink of that, right, and you have a few mouthfuls of it, you feel better.
Right.
You feel like you have energy. You feel better. It's like your body's, honestly, it sounds hokey, like a big thank you.
Well, you do get, we call it, and I thought up the term a couple of years ago with Ryan, called a cellular handshake, where, your body gives you a high five, or cellular handshake saying, atta boy, atta girl.
You can feel it.
You can feel right away, your body just says, wow, that's good.
And Steve's on a budget, tight budget.
Right.
So he wanted something, and he couldn't believe how big the container is. It's like a big 2-pound container. He says, wow, that's great.
Yeah, you get a lot of material. You get a really good deal is what you have.
Yeah, it is cool. So I wanted to tell you that, Bill.
Oh, that's very good.
And the listeners as well. You're all my elite listeners. Everybody else stepped down. Just kidding. Okay, let's get into the emails, Bill.
Yeah.
I'm going to start with Martin. Martin says, Dear Dr. Deagle, my name is Martin now. My 25-year-old daughter has medical issues that the medical community hasn't been able to help. How can we make an appointment with you so she can speak with you directly? I put that question up first because I thought it's appropriate. How many times do we get this, Bill? The medical community is doing nothing. The person's suffering. And Martin, my dear sweetheart, you are not a customer of Nutrimedical, so we will send you off the what is it, Bill?
Well, basically, there's two different consult levels. Firstly, the email. If it's an email, we'll send you the request. If you're going to just send me an brief email, it's $75 per unit. If it's real simple, it's 1 unit. If it's complex, it's more. And I'll put that in my email. If you send me a whole pile of history on a number of individuals, I'll say this is going to take a lot of time. Usually it's just 75. That's 95% of the time. And then if it's a actual review of history, medical records, and MRIs, and all this stuff, I'm going to be charging a proper full consult fee, which is $150 per half hour.
Well, here he is asking for that request for phone consultation.
Right. So, and that way I can provide not just kind of a slap job. I want to actually provide a professional job. So,
but you do that for everybody.
I do try to do it, but now I'm overwhelmed now. So what I try to do is I'll tell them when it's appropriate to see a surgeon, or doing conventional tests like MRI or CT, for example, if they're trying to stage their cancer. What drugs are safe to use, and 20% of drugs are appropriate 20% of the time. The rest, they're meddlesome or dangerous. And I'll tell them which ones, and if they give me a drug list, I'll give them to say which ones they should also substitute for natural therapies rather than drugs, and what drugs you can't stop quickly, like beta blockers. And for example, what drugs you should stop right away, like, clotting agents and so on. You're trying to prevent.
But this will sift out looky-loos, as you call them, and people just coming through. And there's only one of you.
Yeah, and I know some people have tried to see if they can kind of just, how can I say it, knock off a copy of Dr. DEAGLE. That's not possible. I'm just wondering.
Knock off copy.
Yeah. And the thing is, I put out the wellness conditions. There have been. I'm not going to name names.
No, I know, but I know what
you know what I'm talking about. Anyway, so the fact is, I'm going to put up the wellness conditions, and I'll put it more like Dr. U, which will give you an entry level. But you need a professional consult, and there are even people wanting to come in and do, quote, a residency where they come in and follow me. I'm too busy to be teaching residents at the same time I'm doing this.
Next is Troy. Hey, Troy from Minnesota. I know Troy, and he is one of our elite Nutrimedical customers. Hi, Bill. Thanks for the protocol. Here is a picture of his daughter's leg. She has a hematoma there, Bill.
Oh, yeah.
She said, he says, what was the protocol for Nutridyne for infection prevention from the inserting of the pressure probe?
Yeah, she basically had a crushed leg and a compartment syndrome, so they put a manometer in. So you want to be taking Nutridyne topically on the area every 2 hours, and you want to be taking it orally, 15 to 20 drops every 3 to 4 hours, orally, with water.
Yeah.
And I would add to that Allison Med, a capsule every 4 hours of the Allison Med. And if you want to get even more extensive, I'd add NutriDefense would be the next thing to boost your natural killer cell activity to prevent infection.
And also, Bill, I do have a couple of people in our emails today that I think it's fair enough for me to read all emails that I get on the Friday show.
The brief, contracted version of it, though, because some of them are long-winded. So you have to, you can't go and have multi-paragraph emails and read those. That would be...
God, I hate change. Like, okay, what am I doing here? Okay, next we'll go for Jonathan. I just ordered your Brain Power product. I can't wait to try it. I've listened to your show mostly on Jeff Rents. How do you... Oh, you do such a good job. It's so nice to listen to you. I won't keep on. I promised myself I wouldn't gush. I haven't heard you there lately. Well, you are there regularly.
Yeah, Jeff had an accident, and I'm regularly there every Thursday night and do some other work over there. But every Thursday night I'm there on the Rents Network as a guest, just talking about every issue like Fukushima and natural wellness and other things.
So Jonathan goes on to say, I was wondering what tests, remedies, suggestions you might suggest. I'm 46, 310 pounds, decent health. It's just that recently a few things have been happening. My blood sugar is getting high, and my blood pressure.
Yeah, first off,
seems to be fun, but it's high. So
well, high blood pressure.
He said his feet are hurt. He said my problem is his feet hurt when he lays down. Doesn't feel like pins and needles.
Yeah, well, he may be getting an early neuropathy. It sounds like he's diabetic or pre-diabetic and has elevated blood pressure, and he's on his way to heart failure and other problems, because diabetics or pre-diabetics that don't control pressure, they're likely to end up with congestive heart failure, which is diabetic-induced mitochondrial dysfunction. Okay. And if he has other problems, it'll cause mitochondrial problems like Bud got a puncture from root canals or mercury amalgams or previous toxic exposure in the military service. Then we've got to get that out of him and support his mitochondria, get his pressure down, get his weight down, reduce his insulin resistance. Because if he's getting foot pain, it's either like a plantar fasciitis, which will hurt when you're off your feet, or he's developing early peripheral neuropathy. They're the most common.
He says, I've noticed that dieting can make it worse, and baking soda and vinegar helps.
Well, the first thing you want to do is get your magnesium levels up. We use magnesium glycinate, magnesium taurate, and Spilkes, which is pins and needles, anxiolytic, and muscle relaxant, calcium magnesium taurate. And then topically, I would apply probably curcumin cream and use our technology like lumen photon and micropulse. That'll get the foot pain away. So the blood pressure, mainly cardiovasc, gamma E+, magnesium glycinate, and Supernox to start with, and Omega Supreme.
We'll be back with Krista from Massachusetts.
Yep, I'm back, and Michelle, you have a couple of questions. Go right ahead.
Okay, Krista from Massachusetts. I was wondering, do you offer any prenatal vitamins on your website? I am looking for the best type I can find, and I prefer to go through Nutrimedical if you have them, but I wanted to ask first. I love every product I've ever gotten from you and want to continue to go through if I can. I tell everyone to go to your site. They don't always listen, but I try. LOL.
Right.
Any advice on prenatal vitamins would be appreciated, and anything else you may suggest to take during pregnancy, too, because we just did that, Krista, with Amanda.
Yeah.
I already take the Nutridyne for years. Best stuff I've ever taken. I agree. Also, is there a specific magnesium and omega pills to take? I saw there's a couple of different kinds on your website.
Yeah, the first thing you want to take is Vitamin Mineral Max and Minerals Plus, one each capsule twice a day. You want to take a low dose of vitamin D, which is very good for bones. Bone generator, because the baby's going to pull bones, so you want to take at least 3 to 6 capsules after the 2 largest meals. You want to take full vitamin K2. Vitamin K is very important for the baby. That's why they'll often done by the postnatally, they'll actually give an injection. Unfortunately, they give K1 and K2 because vitamin K2 is the most important for bones, not K1. And then I would also recommend that for the brain's development, they take Omega Supreme, and you can take the Omega Supreme Krill or Omega Supreme. For the baby's brain development, Omega Supreme is adequate, but you want to also add Neurogen, which is DHA, docosahexaenoic acid, and you can use Omega Supreme Krill. Those are kind of like the essential nutrients that I tell people. And of course, you want to take a good smoothie, I'd use the Life Support, which gives you all of the macronutrients, minerals, vitamins, etc. But the extra calcium, the vitamin D, the vitamin K2 is very important. And you can also give Myco D2, because that helps improve bones. And for iron, I recommend ferritin, which is iron 3. It won't cause constipation. So those are kind of the core. We have it under the wellness conditions.
Bart, in an email, Doctor, you and Jeff are a perfect complement to each other. Hope this arrangement perpetrates itself for a long time. It's a pleasure to hear cerebral persons carry on an intelligent conversation for a short time. Too bad it's only for a short time. He doesn't realize that Jeff is okay and you're back, Bill?
Yeah.
Let's see. He wanted to say also that his mother was an RN at the Baltimore Hospital, and at that time the hospital would not let resident surgeons perform their operations because it was a nationwide problem with surgeons to experiment on. It goes on to say, he's got. Look how Bill. It's a book. It's a book. Right. Let me see what he wants to ask about his grandma. Anyways.
You have to pre-read and highlight it,
basically, I guess. There's a lot of stuff in there. It looks like it's cancer that and we did a lot of cancer protocols the last couple of weeks.
Yeah, and actually I'm also going to be updating it with the information I had from Anna Marie Eisels, the lady that is the directress of the Eisels Clinic in New Mexico, their affiliate clinic in the Riverside Loma Linda Hospital with Dr. Kim, and their son, Dr. Eisels, who does gene-based cancer therapy up in Santa Barbara. We also have BioCare and the Oasis of Hope. I augment those. Everyone should be on our nutraceuticals for cancer. I do not recommend paint-by-number chemotherapy. You have to have gene-based testing if you're going to do that, like the Dr. Eisels in Santa Barbara or the Brzezinski Clinic. Dr. Eisels is much less expensive. They have alternative other care, which is what I recommend rather than Brzezinski. I tell people never do radiation therapy or proton therapy. It's very dangerous and stupid. Don't do it. And the primary thing about surgery is try never to do surgery unless you have a blocked viscus or an artery or vein or nerve. The primary thing is you debulk the tumor. You actually can spread it to the lymphatics. You want to be starting some form of cancer therapy beforehand, whether it's dendritic vaccine, which they can produce, the coli vaccine, Laetrile intravenous, the hyperthermia, and other treatments. Because if you start doing surgery on the tumor and there's no actual anatomic obstruction of an airway or the bowel or something else where you have to do surgery, you're actually spreading it through the local lymphatics and you'll actually spread the tumor. So, and you don't want to wipe out the immune system either with regular chemotherapy. It's bad.
Suzette from Oxnard here in California. I thought you might know of a good holistic dentist. I have a molar that was filled when I was a child over 30 years ago that is decaying. It cracked a few weeks ago and a piece came off yesterday with another piece of it loose. I'm afraid of dentists and haven't been to one for decades. I'm afraid that if I have any work done to remove it, the infection will spread into my blood and throughout my body. Do you know any dentists in Southern California area, an oral surgeon may be required, that would make my teeth better and not worse?
Yes, my own personal dentist, after a tremendous amount of research, is Dr. Jeffrey Kerbs, Kerbs, and we have a link directly in our associates. He's the most brilliant dentist I've ever been to. He's also got so many certifications, it's amazing. He is able to do cosmetic surgery, and he's rated the 3rd highest dentist in California. That's really amazing. Yes. He's also a board-certified biological dentist for the American Association of Biological Dentists, AAEM, and very compassionate. He has everything. For example, ozone therapy to kill infection of the bone, laser treatments, the most advanced in terms of treatment with protection against making sure that you don't get toxic from mercury, and gutta percha, which is and he can actually if you want to call recarve and structure your teeth with the most advanced materials known. So he can rebuild the teeth, and you'll be absolutely stunned by how good the treatment is by him, his staff, like Janae, and their other oral hygiene staff. So contact him. Go through the link and contact Dr. Jeffrey Curbs. You'll be happy.
Dan from Oceano, California. I just got my shipment of nutraceuticals. I got the Life Support, Nutridyne, Cardivite, and Alimax. I listen every day and know my choices are really, really good. I would love to have dinner with you in a restaurant and ask you about the things you don't say on the show that you know about. Tomorrow it's my privilege again to hear you on the radio. Love you, Big Bad Bill. That's fun.
That's it.
Well, funny, I just said, you know what, Dan? You are an elite Nutrimedical customer. Everybody that's a customer is an elite Nutrimedical customer. Is that true or not quite? Because Dan's elite.
Yeah. Well, you ladies are the ones that interact with most of the people. I have a select group that they are doing consultations or have really complex problems. And we're trying to coordinate them. So you ladies know much more than I do who's elite or not.
Oh, my gosh. Here comes another email from Tom from the County of Angus in Scotland.
Oh, yeah.
Tom from Scotland.
He has some very good, what I call Scottish Celtic jokes.
Here he goes to say, Dear Michelle, the order arrived today. Thank you so much. I have all my lovely NutriMeds and feel great. I've really missed taking them. He was off for a little while. He says, what's he say? I'm not schizophrenic. The combination really has a calming effect, right? That calm mind.
Oh, yes.
And clear, and I have energy again. So thanks again for all the blessings of knowing you and Dr. Bill have given me my life back over the last 8 years. He's known us, Bill.
Yeah, that's right.
He said he's beat bowel cancer. I remember that. He's beat diabetes. I remember that too. Stomach ulcers, and most recently the flu.
Right.
That bad flu he had.
Yeah.
He says, you saved my life. Oh, that's so sweet. To which I'm eternally grateful from the bottom of my heart. Thanks again, your friend Tom in Scotland. Here's a wee little joke, he says. Roses are red, violets are blue. I'm schizophrenic, and so am I.
That sounds like...
Oh, God. That's another good one. I must have this. Being Scottish, I think I have a sense of humor.
We don't want to try to cure a sense of humor. We'll leave that alone.
Oh, boy, that was funny.
Yeah.
Okay, Carlton. Hey, Carlton's from just south of us, Bill, San Diego. Hello, Michelle and Dr. DEAGLE. I have Lumen Photon and Metathera products. Is the Metathera still a product you support since it's been dropped from the products list?
Yes. It's a good technology. It's one of the most advanced German frequency-based technologies. The most portable is the micropulse.
That's why we switched, because it was a lot less money for you guys.
Yeah, and the micropulse is now amazing. I just got my micropulse. I was using a small pulse, and I love it. It's amazing. Okay. But the Metathera is great technology. It actually does frequency-based therapy, and a lot of research going on in Germany on that. And
when we come back, I'll finish Carlton's question.
Very good. And, Michelle, you have lots of questions. Let's roll.
Oh, yeah. With Carlton there, his question was, can the Lumen Photon and the Metathera be used to treat an enlarged, inflamed prostate? PSA is currently 10.1 from 7.2 3 months ago. What else would you recommend concerning the prostate?
Firstly, you want to put it on the sodium-potassium channel setting for the Metathera. And Lumen Photon, you want to be putting it on the setting number 7 for inflammation. Mm-hmm. What you need to do is you need to start doing several things. First, you need free and combined PSA to make sure it's not a PSA that's due to not just benign enlargement but precancerous. Mm-hmm. And if the PSA indicates a high risk of it's broken through the Glisson's capsule, you want a transrectal ultrasound and needle biopsy with a karyotype analysis of the DNA by a pathologist. To rate it, the best way to rate if it is a cancer is a spiral CT and PET scan. We have diagnostic technologies available as well that can test it and monitor your progress. The 8D LRIS is the technology that I recommend now if you want to get an 8D LRIS machine. The free and combined PSA is a very simple test covered by insurance. The nutraceuticals to take are Hormone Synergy 2 capsules in the morning, Vision Max a capsule twice a day, Prostate Flow 2 soft gels twice a day, NutriDefense 2 capsules 3 times a day. NutriDefense, which is an anhydrous catechin, research done indicates it'll stop prostate cancer. Now, one man with this level of dosage at 3 capsules or 2 capsules 3 times a day got prostate cancer in 20 years in their study that's been published. Okay. So those are the primary things I would use, and of course I detox heavy metals with the Keeler Max and Ultrazeolite and Semethyl, and the chemical Xenoestrin Detox, NutriDefense, and the Green Tea Select. Those will pull out the chemicals out of the body, and the lumen photon therapy and the Medithera are very effective at helping to reduce inflammation.
Next is Susan in an email. Dear Dr. Bill, are you familiar with this rare disease called that Fabry disease?
Yeah, alpha-glucosidase disease.
What protocol would you suggest? And if there are any Nutrimedical supplements and any network resources or specialists you would recommend, I'd be very grateful. This, again, is someone who's not a customer, Bill?
It's going to require a consult. I did post up some news up on the news site of Nutrimedical, but that's going to require
But in our Friday show, if you listen into that, maybe you'll become a customer because you get to know us.
Right. The first thing
go ahead and answer.
I'll give a short answer. The alpha-glucosidase is the enzyme deficiency, and there's some various research approaches toward it, including a drug that's an enzyme drug to help to bring it, but it's extremely expensive to use that enzyme drug. There's other approaches that will help to amplify the alpha-glucosidase activity. So it's quite complex, so I can't do that in a few remaining minutes here. Yeah. But I did post 2 articles up on the news section on Nutrimedical that you'll see there under genetic disorders. If you just go under the specific subsection on genetic disorders, you'll see 2 articles and hyperlinks directly to those articles on Fabry disease, which is a genetic disorder that causes accumulation of various products because of a lysosomal deficiency syndrome called alpha-glucosidase.
This James from Connecticut, Bill, kind of quickly here, he's got a few things, but one of them's aortic aneurysm, and I think I've had a few people ask about that lately.
Well, first off, if you get an aortic aneurysm, it's less than 5 centimeters. I know how to stop it so it won't expand. It's really simple. You take a Collagen Max twice a day, and you take a Mountain Red Velvet, open it under your tongue 3 times a day, and those 2 things will just stop it from expanding. You do an ultrasound every 6 months to make sure it's not accelerating, and you do a transabdominal ultrasound to make sure you're not developing what's called a tunneling, which is underneath the intimal lining of the aorta, so even though it doesn't enlarge, you can actually get into what's called a internal rupture of the aorta. So they can do that, see it on an ultrasound. If you take our nutraceuticals, a Mountain Red Velvet and Collagen Max, it'll stop it cold. And I also recommend you take with that it's copper Regenamax, 1 capsule twice a day, and the Minerals Plus, the zinc and the other minerals necessary for the connective tissues, and High Dose Power C. 3 capsules twice a day with a full vitamin K2, and that'll increase your connective tissues along with the Collagen Max and Mountain Red Velvet, and you'll notice that your aorta will not expand, and you'll avoid a Dacron aortofemoral graft, because roughly 1 in 20 people that go through the surgery go to heaven. They don't survive. It's a big surgery. It's dangerous surgery. So
what's this other thing he has? What's that?
Axillary lymphadenitis. Basically, it's usually caused by heavy metals like aluminum deodorant, or it can be caused by mycobacteria and fungi. You get inflammation of your lymphatic glands, and they'll expand, like a big ball of inflamed lymph glands.
All over?
Usually underneath the armpits is the most common thing. It's really caused by mycobacteria and fungi. And what I use there is I recommend night Nutridyne every couple hours on the area. Put it on your fingertips, or spray 1 in 5 dilution on there. Use the roll-arm deodorant from MG12, which includes trace minerals from the Dead Sea and magnesium. Put curcumin cream on it 4 times a day, the curcumin anti-inflammatory, and orally take Allicin Med, Nutridyne, 20 drops 3 times a day, NUTRIMEDS 3 times a day, and spray under your arms with Silver 100, 4 to 6 sprays every couple of hours, and it'll turn it right off. And the anti-inflammatories are Cell Defense and Inflamex, because you need both the tissue anti-inflammatory and the interfascial inflammatory, because you get fibroblast infiltration of the area that blocks the lymphatics, and it gets pretty nasty. So the conventional doctors have no treatment for it. It's effective, and steroid shots are not good. And the main thing is they'll probably biopsy the nodes and make sure it's not cancerous, which, sometimes you'll see cancer there, but it's...
This has been asked about many times, Bill. Post-radioiodine hypothyroidism.
Basically, when you do radioiodine, you can't get rid of the entire gland. You get rid probably anywhere from 60 to 90%. And if you take Nutriodine and mitothyroid and selenium cruciferate and Minerals Plus over the next 2 years, most people, their gland will grow back. And what you need to do is follow your free your levels of T3, reverse T3, and high sensitivity TSH, and T4 levels, the free levels, and your gland will, over a couple of years, usually return to normal function. But you'll need to take at least 2 capsules twice a day of the mitothyroid, along with the selenium cruciferate twice a day, Minerals Plus twice a day, and the gland will actually return. And I use Nutrifos and Neurogen. Okay, go ahead.
Tom from Texas. I'm trying to get this in, Bill.
Yeah.
I'm a member of your site, and I have a woman friend that I've been helping. She's 48 years old and infested badly with bed bugs. She's being treated by doctors, a dermatologist, and she's having no success, and they're costing $350 an appointment. And, that's kind of what he said. Is there some kind of a machine or something?
Well, first off, she's probably getting reinfected from her own furniture and bedding. So she has to fumigate the bedding and the home. And number 2, all her clothes have to be properly bought through probably a dry cleaner. But in terms of her own body, it's easy to get rid of bed bugs. You take our 3 antipathogenics, Nutriodine, 20 drops 3 to 4 times a day, orally in water. You spray under the arms every 2 hours with a 1 in 5 dilution of Nutriodine. You use the Allicin Med orally, which kills off the bed bugs, because basically it's a tick repellent, mosquito repellent, and bed bug repellent, because there's thiol chemicals present in the Allicin Med that'll actually make the bugs go crazy. They don't want they're basically, bed bugs are like micro vampires. They go in and they actually suck blood out of you. So if you do that and you take let's say, spray on the areas, also Silver 100, take our anti-inflammatories.
One of the doctors, that charged him, the $350, suggested she spend time under a hairdryer with intense heat to help kill the bed bugs.
No.
But what good's that going to do if you don't get them out of there?
No, what you do is a Nutriodine, firstly sprayed 1 in 5 dilution on the areas, or put on your fingertips first, and so the alcohol is vaporizing, and then you just apply it. That'll knock it off very effectively.
But you need a professional in to get the place clean, right? In the first place?
Yeah, and you'd also need recommend that you take the MG12 baths with, magnesium oil or magnesium bath salts a couple times a day. That'll help tremendously. Because remember, you don't just have bed bugs. You usually have dermacentor mites and other pathogens in your skin. And, for example, psoriasis is actually a reaction to dermacentor mites that produces interleukin IL-27 at the prickle cell layer of your skin, and that's why you get the Koebner's phenomenon.
You can take a bath with Nutriodine in it.
Right, and I usually will take a full drop of Nutriodine along with your magnesium oil in your bath, and bye-bye. Bed bugs are going to bed bug, not heaven, they're going to bed bug hell.
Oh, God.
They're going to actually bed bug Valhalla. How's that?
It's the weekend. It's the weekend, my dear.
Yes, it is.
Everyone have a wonderful, blessed, happy weekend. We love you all. Thank you so much. I'm trying to say thank you so much for all your support. Thank you for supporting Bill. God bless you again. God love you. God loves you.
Yeah,
okay,
that sounds
that's what I say to Kelsey.
Familiar,
That's what I say to Kelsey. God loves you.
Yeah, well, I want people to appreciate what we do here and follow your instructions and get well. Back in a moment, hour 2.